What's up, everybody? We're back. We got a topic today that I'm really excited for. I've been saving this one for a little while. It is the topic of the century, the great debate, heat versus cold, hot versus freezing, ice versus heat. When do we use cryotherapy? When do we use thermotherapy? What modalities can create each? And is one better than the other? Is one a go-to all the time, or should we? And when should we avoid certain ones? All right. So heat versus ice debate. Um, Initially, we were telling people to rest, ice, compress, and elevate their acute injuries or sudden injuries. Um, Now that we've done a lot of the research and looked deeper into that, even the person that came up with the RICE acronym in the 70s has come out and kind of debunked it and kind of stepped down from his stance, saying that ice is not always the right option for acute injuries. The primary reason for this new kind of message or belief is that we're finding that ice decreases the local metabolism of the injury site. And we've always known this. But what they're finding is that by decreasing or bypassing that initial inflammatory response, the body the body doesn't get the same message, and so it doesn't respond the same in the hours and days following. So what I mean by that is that if we roll our ankle, and we could say this is similar to maybe like a car crash, right? With a car crash, there's a big object, which is the car, and then there's a bunch of little objects, pieces of the bumper, maybe glass, broken objects that are in the road. And so if we ice it, we slow everything down, right? So we big traffic jam, right? And we slowly remove the car. And then maybe they just brush the debris off the road, but then traffic wants to get by, and so the cars just start coming through, okay? But there's still debris in the area. And it takes the body longer to then clear this debris out. Whereas if we don't ice it and we don't slow the metabolism down initially, the body's pretty good at sending in chemicals, for lack of a better word. They're much more specific. And if you want the actual names, I check out a different video or read the research yourself. But the idea being that it sends in workers early to sweep away the glass, sweep away the broken pieces of bumper, a tow truck to get the car out of there, right? And so it does a better job or a normal job of what the body wants to do anyway. Which is clean up that area and get it ready for new tissue, right? So if it's a sprained ligament, the body wants to get right going initially, seconds after the injury happens. It wants to start laying down new tissue to help that ligament heal. So instead of RICE, the couple of new acronyms that we've been kind of spreading around are PEACE, right? PEACE, and LOVE. Okay, so with the PEACE acronym, where the P stands for protection, the E stands for elevate, the A is avoid, the C is compression, and the E is to educate. And we'll talk about these in a minute. But the LOVE acronym is for load, optimism, or stay optimistic, vascularization, and exercise. Okay, so with the PEACE and LOVE together, we're finding that this it gets better results in a research setting as well as a clinical setting. And so I'm going to try and keep this video fairly short, so I don't want to get too wordy. So I'll use an example for PEACE, right? For P, protection. If we're talking about like an ankle sprain, that may be a pair of crutches. Okay, initially. The E, elevate. When the athlete or person gets home, maybe they lay on the couch, they put their ankle up on the armrest, and they elevate it over their heart, and so that way gravity is working in our favor. The A, avoid, maybe to avoid an aggravating type activity. So, I mean, if it's an athlete, that may be avoiding practice, avoiding weight training, avoiding competition, etc. You get the idea. C, compression. So we can do an ACE wrap, or like a neoprene sleeve of some type that helps add compression from a distal or the toes up to the lower leg. And E, being educate, that's the purpose of, say, these videos, or your athletic trainer or your physical therapist or your doctor, maybe even coach. Whereas, it's educating you, the viewer, on all the good things you can do to help put your body in the best position to heal, and educate yourself on what to avoid so that you don't, number one, re-injure or re-aggravate an already compromised area. Now, the LOVE acronym gets a little bit tricky. So the L for load, a lot of our joint nutrition, a lot of our cartilage gets their nutrients through intermittent compression, or loading and unloading that tissue. So the L for loading, it has to be done appropriately. If it's a bad ankle sprain and you're supposed to be non-weight bearing, then maybe it just goes by like a weight stance, where you just shift your weight from your right leg to your left leg, right leg to your left leg. If you're allowed partial weight bearing, maybe that means that you're walking with crutches and you're taking 50% of your body weight off of that limb. But the idea being that you definitely want to intermittently compress or load some of the time to help that joint get its nutrients that it needs. O is optimism. They found that a lot of the patients in the research setting that stay optimistic and see that light at the end of the tunnel, and realize that, okay, I'm an athlete, I might miss 1 or 2 games, but you know what, my season's not over. I need to stay on board. I need to listen to my healthcare provider, elevate my ankle, do my ankle pumps, stay off of it during the day, but yet do a 50% recovery bike, this afternoon or during practice in the weight room. So the optimism is really big on seeing favorable results later on in the injury cycle, or return to play cycle, I should say. V, vascularization, gets to what I was saying about kind of getting that joint nutrients. So we load it, we stay optimistic. Vascularization is heat, man. We got to get some heat in there, get some new blood flow. Maybe it's an elliptical or a stationary bike, or swimming is a really good form of exercise that doesn't compress or put a lot of weight on the stress on the joint, I should say. And there's creative ways to find other means to help bring blood flow to that area. And the last one is exercise. So if you're an athlete, or and your sport is soccer, you need to maintain some level of cardiovascular endurance, but also it can be a different form. It can be, like I said, a stationary bike, elliptical, something where you're putting a slight stress on the tissue, so it's used to breaking down and rebuilding. Maybe it's an upper extremity lift in the weight room, where you're staying off of the lower extremity, but you're putting a strain on the tissues in the upper extremity, so the body won't differentiate. It's just going to heal stuff. So if we kind of break down our chest and tris in the weight room, and do some core work, the body's going to say, we need to heal these muscles, and it's also going to send healing nutrients and healing components to the ankle. All right, so now that we've gone over the peace and love acronyms, what are some forms of heat that we have access to? A really good one that I like to recommend are hot tubs and jacuzzis. They feel awesome. They're really good. They're a regulated temperature, and they're really good at bringing blood flow to the area. But if you don't have access to that, most people have access to a tub. So a warm bath, a hot bath is a really good, for 8 to 10 minutes, 10 to 15 minutes is a good form of heating. Then there's like the smaller items, or the ones that maybe are more joint specific, like either a hydroculator pad in a sports medicine setting or physical therapy, or some people have the homemade kind of rice heating packs that you can kind of warm up in the microwave. Even something as simple as a hand warmer will produce heat, and it will get the same thermal effect to bring blood flow to the area. A couple others that if you're in a sports medicine setting or a clinical setting, like a paraffin bath or like a hot wax is used pretty often for finger sprains and things of that nature. And also then there's ultrasound, which is a modality. There's kind of thermal and non-thermal, but a thermal or heat application of ultrasound is really good for warming up tendons and things of that nature. So those are a few heating modalities. Obviously, if you can think of others or you want to share with the community, please comment them below. We're always looking for new ways to kind of reach out and engage the community. So please share your heating modality tips with me as well. But the best form of heating comes from within yourself, meaning if you are able to do a stationary bike, elliptical, or a non-weight bearing form of activity and raise your core body temperature from the inside out, that's going to be the most effective form of heating that you can do. And then once you've done that and you begin to slightly sweat, you can add in some other stuff like I've talked to in previous videos with like foam rolling and stretching and dynamic movements and things of that nature to help rehabilitate the injury aside from just heat and ice. So that's kind of the topic for today. I mean, this has been more focused on heat rather than ice, but it's all part of kind of debunking the whole, I have an acute ankle injury. Someone go get the frozen peas. Someone go get the ice bag. We need to freeze this thing up. We need to take care of the pain right away. It's a different type of thinking, but it's really transitioning to where we're going as a healthcare profession. So especially with athletics, related to athletics, you're seeing, and you've seen it for years, but it's just taking the ice out. Where your baseball pitchers will run poles after they throw. You're not seeing them packed in ice anymore with big ice bags all over their shoulders. There's much more into the active recovery and heat and helping your body do what it wants to do already. So I would be remiss if someone said, so Justin, in your setting, you've never handed out an ice bag or you refuse ice bags to anyone that asks. The answer is no, right? I mean, if there still is an application for ice, it is definitely that it is a powerful analgesic or pain reliever. If I have an athlete with an acute injury and they're in a ton of pain and it's looking like it's going to be a long recovery process and they just need pain relief, I will recommend to them that they apply ice for no more than 10 minutes, 2 to 3 times a day, one of them being at night because they're going to stiffen up overnight as they sleep anyway. And sometimes some pain relief before bed can help the body kind of get into that resting state. So I will still give out ice. I'm definitely shifted to more of like, 80-20, 70-30 to trying to really educate my patients on the benefits of heat and how to avoid ice through the peace and love acronyms. But definitely we minimize the application of ice and we're seeing pretty good results. And it's something that I definitely think that if you're interested in it and you're watching this video, you should definitely try it. Unfortunately, people get hurt every day. The next injury that you sustain, give it a shot. Try not to ice it. Maybe if it's a hand injury, get a hot bowl of water, put your hand in it a few times a day. When you take it out, it should be red. Obviously, don't burn yourself, but it should be red. And you're going to see the results for yourself. There's no better way to do it than that. So that's the topic for today. That's the video, heat versus ice. Hopefully you enjoyed it. If you did, please subscribe and like the video. If not, I always encourage people to dislike the video or comment below why you didn't enjoy it, or if you have a different belief or you'd like to add something, by all means, please do so. And that's it for now, but I'll see you guys in the next one.